With the rise of the COVID-19 pandemic, a shift in the educational system has been transitioned to a non-traditional way. In the Philippines, schools have started to adjust their new mode of education towards distance learning. Although online learning is an opportunity to those with access, lack of social teacher-student presence and inability to observe demonstrations personally can affect the overall student growth in their chosen course. Last year, student nurses have entered a new mode of education, and that is distance learning. Good day, ladies and gentlemen. My name is Rafaela.
I'm Raksha.
I'm Trina.
And I'm Freddy.
I'm Lucia.
And today we will be discussing our research paper entitled Lived Experiences of LaSalle Nursing Students Towards Distance Learning. Well, we decided on this topic because we want to know how distance learning affects the overall student growth of students in terms of their chosen course. We would also want to know the significance of the holistic status of a student.
For the objectives, this study explored the lived experiences of LaSalle nursing students towards distance learning during the first semester of the academic year 2020 to 2021.
As for the significance of the study may be beneficial to the following. For the academic administrations, the result of the study may be able to aid administrators in determining the strengths and weaknesses of their approaches, instructors, and students. Moreover, this study may serve as a basis for the administrators in establishing policies, guidelines, and better approaches in providing quality education through distance learning. The College of Nursing clinical instructors, the outcome of this study may supply as a foundation for the professors as to which areas needs improvement to formulate an effective and efficient education to the nursing students, whether it may be during lecture discussions or skills laboratory classes. Furthermore, the results may be used to assess the performance of both the instructors and the students. For the nursing students, this study may be beneficial to the nursing students in evaluating the efficacy of the distance learning approach. Moreover, this study may serve as a guideline as to what areas needed improvement to ensure that students will receive quality education. And lastly, for the future researchers, this study may serve as a reference for any research relating to the impact of distance learning to students.
The study was anchored to the humanistic nursing theory wherein it revolves in the person's own style and uniqueness with no the same experiences. Application of the theory in this study is on the lived experiences of students as well as their current social and environmental situation which can produce certain effects towards distance learning.
As for the conceptual framework using the humanistic nursing theory, it is divided into dependent variable and the independent variable. The dependent variable includes the student profile, which states the age, the sex, the device used during distance learning, the type of residence, and the connectivity status, while the independent variable is the lived experiences of LaSalle nursing students towards distance learning.
As for the research design, qualitative research focuses on understanding a research query as a humanistic or idealistic approach. The research design used in this study was phenomenological descriptive study, which tells us about the experiences of every individual using the description that each of them had provided. For the participants, 7 College of Nursing students will be the potential participants. 2 students each from the first and second year, and 3 students from the third year. As for the sampling technique, the purposive sampling technique was utilized.
For the interview guide, the relevance of interview in regard to this study is to identify possible insights and common characteristics that a person may have towards distance learning. The research instrument interview guide consists of 2 sections. Part 1 will gather the needed data for the first, second, and third year level based on student profiles such as age, sex, device use during distance learning, type of residence, and connectivity status. For the part 2 will consist of lived experiences among first, second, and third year LaSalle nursing students such as the respondents' coping mechanisms, challenges, and perceptions regarding online learning as a mode of education.
For the data gathering procedure, we researchers made a request letter to be presented to the Dean of the College of Nursing. We also made a consent form, formulated an interview flow, and present the consent form to the participants. We applied corrections to the both consent form and interview flow and discussed it with our RLE professor. We schedule an online meeting via Zoom or Facebook Messenger depending on the availability and connectivity of the students. A video recording was done and data from the recording was transcribed and assigned to specific themes.
The data was analyzed through Coalizzi's method of analysis, wherein the steps are as follows. First is reading and rereading descriptions, and then extracting significant statements, then formulating meanings, categorizing it into clusters of themes and validate it with the original text, then use the describing, and then returning it to the participants and incorporating any changes based on the participants' feedback. As for the ethical considerations, using the National Ethical Guidelines for Health and Health-Related Research, the participants are not subjected to any types of harm, using the informed consent prior to conducting the study, and the participants are given the right to withdraw and given the right to refuse any personal data, and then ensuring adequate level of confidentiality of results and outcomes of the study. The data will be kept until the end of academic year 2020 to 2021.
For the results and discussion, the theme that emerged was distance learning has its advantages and disadvantages in this time of pandemic. Significant statements include that they have disadvantage and advantage such as connectivity issues. It is a good way of conducting classes during the pandemic and the like. The second theme that emerged is that distance learners make use of time management and other forms of coping mechanisms during distance learning. And significant statements include time management, social activities, academic break, self-care, and family bonding. The third theme that emerged is that the challenges encountered are concerns that made the respondents experience distress with the new mode of education. Significant statements include connectivity issues, lack of learning tools in RLE, tons of unnecessary workloads, time differences, and network satellites interruptions.
As for the conclusion, so this section presents the conclusion drawn from the results of this study. Advantages such as efficient alternative to having classes while following health protocols, and students tend to learn at their own pace. However, the disadvantage is it defeats the purpose of nursing practice due to inadequate resources, distractions, language barriers, and lack of physical demonstrations. Next is the different coping mechanisms of student nurses like having proper time management, self-care, academic breaks, enough rest, and social interactions. And lastly, the challenges encountered by the student nurses such as connectivity issues, time difference, and the lack of learning tools needed for the concepts in related learning experience.
As for the recommendation, the USLS administration and College of Nursing should foresee and on the relevant technology to be utilized, and then implement any inclusion criteria for all students, then consider the importance of data privacy and prioritize solutions to possible challenges. Next is the Guidance and Evaluation Center to organize programs directed to handling stress and stress management. The online or telephone counseling is needed, and webinars via Zoom on topics regarding the mental health and management, which is accessible to everyone. As for the clinical instructors, it is recommended to understand the students' perspectives, and in planning the class activities, minding how students can engage on their mobile devices. And as for the nursing students, the class officers should collate all queries and challenges, and then managing time effectively is also essential, and then valuing and prioritizing the goals by doing a to-do list, and keeping the record of the priorities and limiting the use of other gadgets while on distance learning.
For the utilization, the results were relayed to the College of Nursing Dean, Academic Coordinator, and Clinical Coordinator. A copy was endorsed to the College of Nursing Office, USLS Administration, Office of Students Affairs, and the Guidance Evaluation Center as a basis for distance learning policy, implementation, and evaluation. This data will be made available for other institutions in improving online learning policies, programs, and services.
For the acknowledgements, we would like to thank our Almighty Father for His guidance and blessings throughout the research work, our College of Nursing Dean, IVG Edemni, as well as our lecturer and RLE professors, Dr. Shaila Trajera and Ms. Sarah Jane Rosales, for providing us an opportunity to create a research study. We would also like to thank the panelists for judging the adequacy of our research study. These are our references used, and that will be all for our group. We are now open for questions.